We may begin.
All right, this city council meeting for April 7 is a call to order. Will you call the roll, please?
Yes, Mayor Studebaker,
Here.
Councilor Kohlhoff,
Here.
O'Neill,
Here.
Nguyen,
Here.
Lamont,
Here.
Wendland,
Here.
and Mann.
Man's on mute.
You're on mute.
Here.
Thank you. Okay, there's been a small change to this evening's agenda. We were going to have citizen comment later, but we'll have it right now, and there hasn't been anybody requesting city comment as far as I know. Has there?
That's correct. No one's requested comment tonight.
Okay, since we haven't received any, in that case, we'll move to item 3.4, which is Chief Johnson. Will you please introduce our guest, Dr. Sahni?
Be glad to. Dr. Ritu Sahni is the medical advisor, medical director for the fire department. And we have him through a contract with the county of Clackamas, and he has additional duties with Clackamas County, but he's our medical advisor, primarily providing guidance on protocols, emergency medical services protocols, and he oversees the licensure of all the paramedics in the fire department. We have over the years morphed him into helping with the AED program that runs in the police department and throughout the city. And with the current events with the COVID-19, we've kind of hijacked him and made him our sounding board for everything medical that happens not only in police and fire, but throughout the city. So with that, I'll let Dr. Sahni talk a little bit about his background and what he does for us and for others. And then he's got a short bit of comment just to tell you what's going on in the state, in the city, and in the county. And then we want to leave plenty of time for questions. So I would anticipate this to be about probably 12 minutes, 15 minutes long, I said. So with that, I give you Dr. Ritu Sahni.
Thanks, Chief. Yeah, I mostly want to leave time for questions. I know that there were some that maybe came up already, but yeah, I'm the Clackamas County EMS Medical Director, and the city contracts my services as the medical director for Lake Oswego Fire, Lake Oswego Police, and Lake Oswego Communications through the county. I am a Lake Oswego resident, however, so near and dear to my heart is home. I've been involved with Lake Oswego 15 years now. I've been the medical director in various iterations, if you will. And then in my county duties, I'm also the medical director for AMR Clackamas County, as well as Clackamas Fire and Clackamas Communications. What it means to be the medical director for an EMS system means that the medical care that we provide as a system is my responsibility. The paramedics function sort of kind of under my license, and then I develop the protocols along with other medical directors in the region that they utilize to take care of our patients, and then work directly with them on training, education, and quality improvement and feedback. Many of you I've met before through our cardiac arrest survivors program, also presenting some items to City Council about that. I think, Mayor, we learned CPR probably, 4 or 5 years ago. I taught CPR on the floor of Council Chamber. And so that has been something that was really great. And hopefully we can do that again when we're all allowed to be in the same room again. And then for the county, EMS is part of the public health division in the county. And as a result, I work for public health, and part of that role, I've been providing support and backup for our public health officer, Dr. Sarah Present. My direct supervisor in public health is the operations manager for public health, so he's the incident commander for Clackamas' Emergency Operations Center. So I've been involved also in the countywide issues around COVID-19. Also served on the governor's task force which convened last week or 2 weeks ago, which feels like 3 or 5 years ago right now. And also in my spare time, happened to do the same stuff for Washington County. I'm the Washington County EMS medical director, have oversight over Metro West Ambulance. And clinically, I work as a emergency physician at Providence, Portland. So the last time I worked a shift was a Saturday night overnight. So that's kind of some of the background. Real quickly on the kind of an update on where we are as a state. We have about the evening report. We have 1,132 cases confirmed in the state of Oregon. We have 90 cases confirmed in Clackamas County. Throughout the state, we've had 29 deaths, and 3 of whom are Clackamas County residents. I would say the general feeling right now is that what we're, I think, now starting to call physical distancing instead of social distancing is working. The curve is definitely flattening. We are, the projections have changed over the last week or two to be much better. And some of the official projections have us not reaching a point of saturation in our healthcare system throughout all of Oregon. So while we feel really good about that, this is not the time to let down. We are still not at the peak of our curve, so we're still going up. And then even when we're on the downward side of the curve, we will need to, as a character in Harry Potter, Mad-Eye Moody said, constant vigilance. We're going to need to continue that approach until we have clear indication as to when this is going to end. So that's kind of all I've prepared. I know there are some questions. That was what Chief Johnson asked. If I would just be open for questions from.
What questions? Anybody have, Councilor Kohlhoff?
Okay. We're getting a lot of discussion about Lucer and the community garden, and there are a number of reasons why I know we decided to do what we did, but also as time's going along, we certainly question some of the suppositions. And the one that I particularly would like for you to address is I do know that the order requests us not to travel except for essential things. And by that, I assume if your grocery store is a half-mile away, or your bank is a half-mile away, or things of this nature, you're certainly okay to get in the car. And the Lusher Farm would probably be a distance of approximately, I don't know, a max of a couple miles from any place in Lake Oswego. I could be corrected on that. But my point is, I'd like for you to address what is the difference between me getting in the car and going to the grocery store, and getting in the car and going to lecture and work at the community gardens, assuming the other issues can be ameliorated, such as the physical distancing and the no gabbing in great congregations and so forth.
Yeah, I think the biggest issue is not so much how far you have to drive to go to what you're doing, but the ability to maintain that physical distancing and whatever, where you go. We've managed through preventing transmission of this virus to really slow the growth of the virus. But what that does is that extends out the time that it takes to sort of let this thing run through our community. And so the thing to really focus on is to maintain distance, that physical distance as much as you can, but also to reduce unnecessary opportunities to have interaction where you may get closer to potentially pass off an infection. So I think it's not so much how far you drive in the car, it's what you do when you get there, whether you are able to maintain physical distance or whether there's increased opportunity for for folks to get closer and mingle, and then potentially increase the number of infections in our community.
Councilor Wendland, do you have a question? Councilor Wendland, you're going to have to unmute. There you go.
Yeah, yep, yes. Yes, a couple questions. Since you're at the countywide level, doctor, and you're seeing all the different resources, do you feel that we have enough PPE availability for our responders and for the people that we're responsible for with the police department and fire?
So I would say that we are adequate, that we are pretty comfortable with where we are right now, but we are not ideal. In an ideal world, we would be using a single disposable N95 mask for every patient encounter. It's the safest is to use it and then discard it before the next encounter. And we are not in a PPE framework in our community, pre-hospital, in the hospital, where we are able to have that a level of usage in PPE. We've got a lot of strategies in place to sort of mitigate the problem. Like Oswego Fire has moved to a reusable format of PPE. And specifically the masks that we're using are no longer the disposable N95s, but a reusable P100. So you don't have a burn rate through there. There are different challenges with a reusable device than there are with a disposable. So I would say that we are in a place where we are adequate, but not yet to the sort of ideal. I feel very comfortable with how our fire department and police and our ambulance personnel with AMR are doing. AMR, as you know, is a national company with with tens of thousands of workers, and their infection rate has been very low. And we are using PPE at least at a level and probably better than what they're using in most communities. So it's not perfect, but I think we're kind of doing the best we can, and I think I feel like we are pretty safe.
Just so everybody knows, PPE is a personal protective equipment, correct?
Correct. PPE is personal protective equipment, and for our EMS agencies, that consists typically of eye protection, a goggle or wraparound glasses of some sort, a mask, whether that be a surgical mask, an N95 mask, or a P100 mask, gloves, and then in certain situations, some type of gown or uniform covering. So that would be the sort of PPE that we use. And typically in normal times, we would use, other than the glasses, which are reusable, we would use a mask, a gown per patient and dispose of it immediately after the patient. But
Councilor Wendland, you had another question?
Yeah, I did. On what do you think of the 6-foot rule? Is that still safe, or do we have to go to 60 feet or 120, or it seems like we're getting various different things from different people, depending upon what news channel people watch. It ranges. I feel that we've had the 6-foot rule in Oregon, and it seems to be working pretty well, but what are your thoughts?
Yeah, I think it seems to be working pretty well. I think that it would be different if like everybody were out everywhere together and 6 feet around, versus the fact that I think cell phone data shows that in Oregon, we're doing really well at staying at home. In general, the 6-foot rule is probably pretty good. The science of this virus has been super tricky, and it's been very difficult to pin down exactly how transmissible it is by different modalities. In general, we still feel pretty strongly that droplets from respiratory droplets are the most common and dangerous form of transmission. Definitely 6 feet away kind of keeps you safe in that particular setting. However, we do have these isolated cases where there's been no identified sort of droplet transmission but you will have had what could be aerosolized or airborne transmission. But even in those cases, it took spending a fair amount of time in the room with that person, with the source. So I do feel fairly comfortable that sort of when you're out walking and you walk past somebody 6 feet away, I don't think there's much increased risk. But if you were standing 6 feet away from somebody who sneezed loudly, there would be still some risk that, there's nothing magic about 6 feet. Some people have really big sneezes.
Right.
I do.
So I think that in general, we still feel like droplets is the most kind of worrisome. And in general, we feel that people are most infectious when they're sick. But we also know that there is a percentage of people who don't even feel sick when they have this. And we do know that those people are shedding virus. We just don't know to what extent that risk really is. And so that's why things have been changed to include recommendations around wearing a face mask in public and sort of maintaining that social distancing.
Councillor Lamont.
Following up on Councillor Wendland's point, we heard from Chief Johnson that we're in pretty good shape for a couple of weeks of backup for our police and fire and our responders. But at the county and state level, I saw graphs last night that New York has got high cases but low amount of beds. We have low amount of cases and a high amount of beds. If this thing is going to ripple through us in a couple of weeks worse, are we good with beds and ventilators and whatnot at the county and state level?
Yeah, so our most recent projections, there are two projections that I like to look at. The state uses has contracted with a service outside of Washington, outside of Seattle, and then the University of Washington has the Institute for Health Metrics and Evaluation. They both have pretty solid projections that look good for us in terms of the state and our ability to manage beds and intensive care units and ventilators. So there are a lot of the built-in presumptions in that. And the biggest presumption is that we maintain our current status of physical distancing and staying at home, at least until the Institute for Health Metrics, I believe, has us staying that way until June 1st. And I think the states is all the way till July 1st. So those projections presume that we do this. And so there's no projection for what happens if we were to suddenly have an increased level of activity in the community and people started kind of sharing the virus again. So that's that being said, we are still the hospital systems that I work at, the EMS system. We are all still planning for the worst and hoping that we don't ever have to implement these things. But Mel Brooks said, "Hope for the best and expect the worst." Life is a play. We're unrehearsed. So that's what we do. We plan for the worst. As an emergency physician and as an emergency EMS doctor, I always have to ask what's the worst thing that can happen and work backwards from there instead of saying what is the best possible outcome and work forwards from there.
Councillor Kohlhoff.
So I had two questions. If people are following that physical distancing of 6 or more, using their heads that way, is there a number of times in a week that would make that appear that they're not staying at home? I mean, what is the continuum there of never leaving the house and maybe going out once a day for an essential thing? Is there, what do you think of that?
So the best way to describe it is that you're playing dice. So every time that you go out and interact in the community, you are it's a dice roll as to whether or not either you, being a sort of an asymptomatic shedder, say, transmit the virus to somebody else, or you could come in contact with somebody who has the virus. And so the more times you go out, the more likely you are to have one of those events happen. And so that's, and I think it's important. I know we talk about the 6 feet distance, And the 6 feet is a nice rule. I think Councilor Wendland asked the question earlier. It is a nice rule of thumb if you have to go somewhere. But I would say that the thing that's most effective and why our curve has flattened and why we look really good right now is because people have been staying home.
So the other question I had was about the fall. So assuming that we really are less limited, let's say July the 1st or June the 1st, whatever that is it your expectation that we're looking at another round, though, of infection starting in the fall? In other words, I've heard
yeah.
that we're going to get well only to get sick again.
Yeah. To be honest, we don't know. We can look at other experiences. SARS-1, the first go around with coronavirus, we got lucky and it didn't really hit the United States. But in Toronto, they had a second wave. They're seeing some reinfections now in Asia and areas that had opened up. I think that one of the challenges we're going to have is that as we get on the downslope and on the back end of this curve, people are going to want to return to normal, and you could see an increase in cases then. Public health is going to need to we're going to continue to need to be aggressive about tracing and that sort of thing. But nobody really knows what's going to happen in the fall. I mean, the best scenario would be some type of immunity from a vaccine. We're still not seeing any indication that anything like that's going to happen until 2021. We don't fully understand why the first SARS episode just stopped in Toronto in 2002, 2003. And so I think it's going to be a lot of just sort of monitoring, watchful waiting, hopefulness, and really good kind of good old fashioned roll up your sleeves public health on surveillance and continuing to message things like hand washing and staying home if you're sick. And some of these things that we've been messaging, you should stay home. You should always stay home when you're sick. That's not, that should have always been the case. But even, I know lots of people who've taken that Tylenol and gone to work, and that kind of behavior probably needs to stop in general.
Doctor, quick question.
Yes, sir.
Have you seen or are you looking for to see if you find an increase in domestic violence and other kinds of violence as a result of some of this stuff?
I have not pulled data to look at those sorts of things. I can tell you that across the board on all emergencies, medical emergencies, those numbers are down. Trauma, medical. I think that question may be better for Chief Jorgensen. Okay. But I can just say that in general, medical emergencies are down quite a bit throughout the state.
Good, thank you. Councilor Manns?
Yes. Well, hi, Doctor. Thanks for joining us.
Hi, Councilor Manns. Good to see you again.
My question is, they're predicting a hot July and August, which could mean that we will have fires. I mean, that's always the problem. Fires, of course, create really, really poor air quality. The only reason I have any masks in my house at all is because of previous bad air quality. Is there, looking forward, would there be a plan, maybe for folks who have lung problems or who it's so difficult, had COVID-19 and recovered, just shelter in place if the air quality is super bad? Has anything like that been discussed?
I'm not aware of any discussions. This disease is so new. We don't know what type of lung function someone who survives COVID-19 has. We don't know we don't really know the long-term effects of somebody who was critically ill. We do know that there are a lot of people, the majority of people who get this disease have mild and minimal symptoms. We have no reason to believe that they would have any long-term effects from having COVID-19. Folks who are critically ill and in ICU and potentially on ventilators, we just don't know what's going to happen to them. Those types, the types of public health announcements about staying in when air quality is bad, I think are sort of would continue to be generally applicable to anybody who finds that they have lung disease, and we'll just have to wait and see how some of these cases shake out.
Thank you.
You're welcome.
Councilor Lamont?
We're hitting the spring allergy season. I look out of my deck and it's
Yes,
all
we
slime,
are.
and my eyes are itching. And are people coming in with false concerns about the COVID virus versus it's an allergy issue? It's hitting hard right this week.
Yeah, I started taking my allergy medicine every night
Yep.
about a week ago because I didn't want to get a new cough or a new sneezing, because I would have to not be able to go to work if I had a new cough. So I've been proactive. I would say that in the emergency department, at least this is sort of anecdotal in my own experience, volume is just so down. I'm seeing some people with kind of respiratory illnesses that are that may or may not be COVID, I'm seeing a few people who are kind of minor respiratory illnesses who are just worried that they may have it and come to the emergency department. But I'm not necessarily seeing people who would come in and it's mostly allergic. But it's certainly a concern. I mean, I think for a lot of folks, like, do I have an allergy? Do I have COVID? That sort of thing. But it can be sometimes difficult. And not everybody who thinks they have COVID or has COVID, needs to come to the hospital, right? A key component is if you have a cough and a fever, but are not having any trouble breathing or chest pain, you're probably better off staying at home and at least trying to contact your physician or our public health line. If you have a primary care physician, most of them are doing virtual visits. I know the hospital system I work for has an online virtual visit where you can see a provider through a Zoom-like interface, and they can lay eyes on you and determine if you need to go to the emergency department. But not seeing more allergies just quite yet, but I personally often go through a month in either May or June where I can't see because my eyes are watering so much.
Councilor Nguyen?
Hey, thank you. Thank you, Doc. Thanks for coming out and talking with us. So on that last point, you were talking about, people being diagnosed by doctors through like telemedicine and such. And so what happens in an instance where a doctor tells a patient that you probably have COVID-19 and you should assume that you do,
Right.
but that person never gets tested. So do you
Right.
still recommend contact tracing in those instances there?
So we're not doing a lot of, and I would have to defer a little bit to Dr. Present. She's not here, but I think, well, number one, we're not doing a lot of contact tracing in that kind of situation. I would say that in the 4 shifts I've worked in the last week, I've had that conversation multiple times each shift. And so, we'll have a relatively healthy person who's got a cough who comes in and they don't meet our criteria for testing. And I tell everybody who's got an illness now, because the test is not great, to assume that they have COVID and that they should go home and self-isolate and try to stay isolated from the other family members, especially if there's a high-risk person in your house, until they're feeling better for at least 72 hours after they feel better, which is a little different than what we would say with the flu or some other viral things where we used to say 24 hours. But with COVID, we say 72 because we think you might be infectious for up to 72 hours even after your fever breaks. So that's what we tell people. You don't qualify for a test because you're not a high risk group or being admitted. There is definitely COVID-19 in the community. Most of the people do very well. Then you should go home and sort of manage your illness by isolation and then all the other standard things, fluids, rest, et cetera, and managing your symptoms.
Right. And then so again, on that topic of testing though,
Yeah.
Is there any, I mean, after somebody gets the disease, I mean, is there going to be or do you foresee a test for immunity, for example, somebody that may have recovered and?
Yeah, that's a really good question. So there are, the current test is what's called a PCR, polymerase chain reaction, but with the acute test, it's looking for pieces of virus in your throat, basically. The test to look for immunity is called an antibody test to see if you have antibodies to the virus. So there are a number of antibody tests coming on the market right now, and they're pretty variable in how effective they are. The biggest problem is that we do not know what it means. If I see a positive antibody, it might mean that you've had it. Depending on the test, there are coronaviruses that are there are seasonal regular coronaviruses. Some of those tests will be positive if you've had one of those. But, so it's hard to know, but we don't know yet how long you have immunity and how effective that immunity is. So if somebody tests positive for IgG, which is the antibody that confers long-term immunity for SARS-CoV-2 IgG positive, we don't have enough information yet to say that you're immune now or not. That's hopefully something we'll learn. The tests right now are what are called qualitative, meaning they give you a yes/no answer. It may be that we need a quantitative test, which gives us antibody levels to be kind of better understand whether or not somebody has immunity. So I think it's in the future, but we're not quite there yet.
Other questions? Dr. Sahni, you've been a wealth of information. Thank you very much for your help.
So before you let me go, I just want to say thank you because we asked him like Thursday if he'd come out on a Tuesday night. And given how hard I know he's working, it is really a great asset to have somebody of his caliber and expertise available to us to answer questions. So thank you so much, Dr. Sahni.
You're very welcome. And we still have to meet in person, Mark.
Thank you very much.
All right, thank you.
Okay. Next on our agenda is council business. And the first item on there is a 2020 pavement rehabilitation project. Erica, you and your department want to talk to us a little bit about that?
Thank you, Mayor and councilors, for having us here tonight. We're going to be very brief, but Stefan Broadus, our assistant city engineer, is there to give a quick presentation, and then we'll be here to answer questions.
Can you guys make sure your phones are muted? We're hearing something in the background.
I'm going to try to minimize the outside noise as much as I can. The betting right now is even money on who ruins this presentation between my dogs, my kids, or myself. So okay. I'm going to try my best to make it either my dogs or my kids here. So, and I think they just went outside for the 7 o'clock cheering. So hopefully we have a few minutes to get through this presentation.
Yesterday we had the ice cream truck go by.
Okay. Yeah. Okay. Okay. So thank you for having me. This item, Mayor, as you alluded to, is to approve the bid award for this summer's paving rehabilitation project. So this is the third of 3 of our big pavement restoration projects this summer. The first being the award for the Wembley Park CIP project, and the second being the slurry seal project that we awarded a few weeks back. And so this project will be pavement rehabilitation, mostly concentrated in the First Edition neighborhood, but will also include Stafford and McVeigh. And so we received bids here recently. We received 2 bids. One of which, the low bid that we're recommending award here, was close to, or actually just over $1 million under the engineer's estimate. So we felt we got really good value on these bids. And with approval of the award, we will move forward with construction, which would start in May, mostly concentrating on retrofitting close to 100 curb ramps, sidewalk curb ramps in the area, and then would move on to pavement rehabilitation in June. So with that, I'll kind of open it up to any questions that you may have.
Stefan, does this particular rehabilitation project include Wembley Park?
This project, no. Wembley Park Road is a CIP project that is got started a couple weeks ago. All three of these projects, Wembley Park, the rehab, and the slurry seal, are under the pavement management program umbrella.
Okay, thank you.
You're welcome.
Other questions?
I'll make a motion when you're ready, Mayor.
Go for it.
I make a motion to approve the rehabilitation contract with Knife River for $7.1 million.
Second.
Discussion? Okay, Madam Recorder, will you call a roll on this?
Yes, Mayor Studebaker,
Yes.
Councillor Kohlhoff,
You're
Mute.
muted, Councillor Kohlhoff. She's asking what your vote on this is.
You're muted. Yep.
Yes,
Councillor Kohlhoff, that's a yes vote.
that's a yes.
Thank you. O'Neill,
Yes.
Nguyen,
Yes.
Lamont,
Yes.
Wendland,
Yes.
and Mans.
Yes.
And the motion passes 7-0.
Okay,
Thank
good.
you.
Next item is the Iron Mountain Park project. Mr. Anderholm? You're muted. Ivan, you're muted. There
Can
you
you
go.
hear me
Thank you.
now? Okay, yeah, sorry about that. So what you have before you is Iron Mountain Park project. It is the full construction project of the project that started back in 2015 with community involvement. Much like the paving project, we're excited to let you know that the construction bid actually came back about $1 million below the engineer's estimate when it came in, and it came in just in over 2.2 million. This is one of two projects that you'll hear from with Parks tonight, and I'm available for any questions that you might have about the project.
Questions? Okay,
I'd like to
I'll make a motion, and this time make a motion to award the construction contract in the amount of $2,256,837 to Pani Inc. for the construction of Iron Mountain Park, and authorize the city manager to sign the contract.
Second.
Okay, Councilor Wendland seconded. Any discussion? Okay, call a roll, please, Madam Recorder.
Mayor Studebaker,
Yes.
Councillor Kohlhoff,
Yes,
O'Neill,
Yes.
Nguyen,
Yes.
Lamont,
Yes.
Wendland,
Yes.
and Mans.
Yes.
And the motion
All right.
passes unanimously.
The next one is the Woodmont Natural Park Project. Again, that's you, Mr. Anderholm?
Yes, it is. Thank you, Mayor. So on this particular project, you'll remember that we brought it before council in December. At that time, council had decided not to award the contract, and about a month later directed staff to get back together with the original PAC, the Parks Board, and the Neighborhood Association and concerned neighbors about the extent of the project. We were able to do that, and we actually had an open meeting where we invited everybody down, and within that meeting, and a couple of the city councilors attended, we were able to find consensus on the direction of the project and make modifications to the project. What you have before you this evening is a result of that meeting and the input. The major thing that you'll see in that is the reduction. There is no permanent restroom or associated utilities with that. And then also the density of some of the planting areas, especially where we were planning on planting Oregon white oak, was reduced based on recommendations of the public and our staff. So what you have before you is a result of that process. And I'll take any questions.
Anybody have any questions? Do I hear a motion?
I'll move to award check for the Woodmont Park Natural Construction Project to Paul Brothers for $1.128.96 million, and to direct our city manager to sign the contract.
All right, any discussion? Councilor Kohlhoff.
So I was a doubter on this, and Director Anderholm took me out there and showed me what was planned, which was a little easier to visualize as opposed to the paper. And at one point, he knows how much I like big trees, and I like them to be left alone. Thank you. And he showed me this big tree, which was, of course, totally dead. And he said, that tree is going to stay there, just not standing. It's going to be, made me laugh and laugh. It's going to be a wonderful park. And I do feel that even though we stopped it for a short bit, that we came up with something that will fit the needs and the budget, but also fit the, will be a good thing for the city. So I'm definitely going to vote for it.
Thanks for your input. Any other discussion?
How about a second to that motion?
That would be great if somebody wants to do it. Is that you, Councilor?
Yes. Yes.
Okay. Ms. Simpson, would you call a roll, please?
Yes, Mayor Studebaker.
Yes.
Councilor Kohlhoff.
Yes.
O'Neill.
Yes.
Wynn.
Yes.
Lamont.
Yes.
Wendland.
Yes.
Mans.
Councilman, you've muted yourself again.
Yes.
Okay,
Yes.
great.
Okay, 7-0.
Okay, that's the end of the council business, except that I think, aren't you, Ms. Bennett, aren't you going to give us an update?
Well, most of the update was given by Dr. Sahni, but I guess there's just a couple things I want you to know about. The first, I don't know if you heard him say it, but I want you all to know that we believe that we're going to be in the current operations with maybe some very minor modifications, probably through the month of May. And so we're simultaneously planning for things that we hope would happen in May, and also planning that maybe we won't be doing those things. So, for example, since you have Ivan still on the call, the farmers market. They're allowed under the governor's order, but they're a challenge because of the way our farmers market works. And so we're simultaneously planning for the beginning of the farmers market and then planning for it not to happen. I don't know if that makes any sense to you, but we think based on what we're seeing, based on what we know, based on what people like Dr. Sahni are saying to us, June is the earliest we should begin to plan for any relaxation of the orders that we're under. I assume that superintendents all over the state are having the same conversations with their school board, but just in case you have any questions, I think that's where we are. I also think that you all ought to know that the issue around, the other thing you heard Dr. Sahni say that's on our mind, and Ivan's heard to follow up on the questions around community gardens, isn't so much about the individual people, is what happens when more than one person decides to engage in that activity. I don't know if that makes any sense either, but things like sharing hose bids at the community gardens, the sharing of tools, the congregation that happens in the parking lot, the safety of our staff if they have to be the ones enforcing physical distancing. So those are the kinds of things that are on our mind right now. Other than that, our staff are generally healthy. Social distancing is working. We're getting a lot of work done. Probably the other thing that's sort of a challenge right now, and we've got a couple of great applicants we're working with, is the got a couple of big land use decisions that would have normally come to you in May. We need to figure out, or not you, but to the DRC in May. And we got to figure out whether that really has to happen or not, because we don't want to create a situation where our neighbors feel like they didn't get a sufficient hearing of their concerns about a development, or developers feel like the process wasn't good and so they can't really rely on the decision. So we're wrestling with some of those issues. Anybody have any questions? And since Ivan's on the call still, you have questions for Ivan?
Councilor Koloff.
So I am going to push that we don't just talk about, but we really put on the table that to some limited extent, even, people can go use the gardens. I didn't hear anything that led me to think that rules couldn't be put into place, limit the number of people that are there. I had been under the understanding that one of the specifics would be no sharing of tools and so forth.
Yeah, it will be, but our ability to enforce it is pretty tricky. And so that's the challenge with the gardens. We're working on it. I just can't tell you right now that we've got it all worked out. Ivan, do you want to answer that?
But hang on, but I don't want it to float. I personally would like for you to come back on, Thursday or the next meeting with something that we could at least discuss, because there is sufficient pressure and legitimately on balance.
We've told everybody April 13th, that's next Monday. So I'm happy to talk to you about what we think we can have in place, but it probably won't be till Monday.
It's fine. So that we can discuss on as close to the 13th as possible.
Yeah.
Yeah. Excellent.
Other questions or comments, Councilor Wynn?
So Manager Bennett, you mentioned the farmers market. So have we, does that also include other events that happen in June, like the Festival of Arts and the other different events that we have, like the lobster feed and those are things? Those, I mean, I know that those aren't run by the city, but other.
Well, the lobster feed's been canceled.
Yes, I can, since I'm the chair, yes, it's been canceled.
And I know the Lakewood Center is talking about both the dates and the scale of Festival of the Arts this year. I also know the Chamber is hosting a fusion event or a meeting tomorrow online, and that one of the topics is to get the various nonprofits that have summertime community events talking to one another about their plans for responding. As I say, and Ivan can talk a little bit more about this, we're simultaneously planning for them to happen and planning for them not to happen sort of at the same time. Because if we don't put the pieces in place for them to happen, then they can't happen. But we also are trying to be realists about whether or not social gathering will, first of all, be allowed, but second of all, be even something that people want to do. I'm sure you've noticed from the email traffic you've received is that we have gotten a broad spectrum of community concern about whether or not, as I said before, and I'm not being flip in any way, some people think we've done too much, we've gone too far, and some people think we haven't gone far enough. And so we know when, even when events happen, they're probably going to have fewer people at them than they have in previous years, even when they're allowed.
Councilor Lamont.
Back to the DRC situation. If I have this right, obviously the clock is ticking on some of these things, and I know the governor's, loosening up some of these responsibilities. But if we do a DRC where neighbors could give input as well as the developer, it would be like we did tonight. So people could either get online on the camera with us, or they could call in, or they could email in. Is that right?
Yeah, that's right. The challenge really is that oftentimes the things that you need to look at, plans and site plans and drawings of buildings, are just much tougher to do in this environment. And so that's why allowing folks to be able to testify in person is better, is if there are documents that are shown, they can see them better. So as I say, we've had a pretty good and collaborative relationship with the developer. David knows this, I don't want to create any procedural error that would lead to an appeal. It might be better to have a 30-day extension of the 120-day rule requirement and let us push a hearing out than it would be to have us have a hearing that turns out to be a flawed hearing that then causes there to be an avenue for appeal, which would drag an application out a lot longer. So I just think it may be more efficient and effective for us, for the developer, and for the neighborhood if some of these things could be pushed off until we're able to have physical hearings.
Other comments or questions?
Was there anything you wanted to add about the market?
So we're simultaneously planning for the market and planning not, kind of like Martha said. What we're doing is we're taking cues from not only regionally, but around the country through our networks on how people are conducting farmers markets. The most likely way that the farmer market will open, and we don't know when that date will be, it's going to be a produce only, prepackaged, product only type market with a great reduction in the number of vendors that are there. There's probably going to be some sort of metering to get in and out of the market with a maximum number of shoppers. It's going to kind of look like people going to a supermarket, and the supermarket's only going to have fresh produce and fruit and baked goods. So, and that's really what we're seeing being modeled throughout the country right now with farmers markets. It's either that or they're actually doing drive-through pre-order. From our standpoint, I think when we look at the venue that we're at and the fact that we'll be greatly reducing the number of vendors, it makes more sense for us to actually have the physical tent set up and allow people to come in a metered area, because we have a lot of lag room in order to queue people before they're allowed into the market. It's something that we can manage. And it's something that, will give some semblance to the traditional market later in the early fall when we're able to get back to hopefully normal operations. So that's kind of the direction we're heading right now on that.
Other questions or comments? Okay, hearing none, that concludes our business and concludes our meeting. I guess we're adjourned. Thank you, everybody, for
Thank
joining
you.
in.
Bye.
Good night, everybody.
Yep.
See you next week.
Thursday.
Thursday.
Thursday, yep.